When the National Health Service was created 70 years ago, the then Health Secretary, Nye Bevan, said it gave Britain the moral leadership of the world. For the first time ever in any country, anyone who needed healthcare could get it, regardless of their ability to pay. But after a decade of austerity, the service, as we reach a certain age, fraying at the edges. Well, joining me now in the studio is David Hare, Chief Executive of the NHS Partners Network. And David Hare, this is private businesses who supply and work with the NHS.
It is. It's private businesses across a range of services, so in general practice, in community services, private hospitals and so on. So a really wide range of private organisations that deliver services to the NHS.
Now, you are often stigmatised. Unions, the Labour Party say no more privatisation with the NHS. And the basic complaint, I suppose, is that the NHS took the profit motive out of healthcare. And by definition, you're representing companies that do want to make a profit out of people suffering.
I think one of the best kept secrets about the NHS, it's always been a public-private partnership, actually, ever since 1948. GPs have been independent contractors to the NHS, and over the years that has sort of steadily grown. I think actually the priority that most people are concerned about, and most people are fairly relaxed about who provides their NHS care, provided it's free at the point of use and high quality. So the focus actually is on ensuring the best outcomes.
No, but the question is the profit motive, though. Does the profit motive fit in a universal healthcare system?
I think it does. I think the profit motive ensures that you drive efficiency, that you drive best value. I think that ultimately a blend of public, private and voluntary organisations in the health service working collaboratively together, as the model that we've seen over 70 years, is a really good one.
But we have seen PFI, for example, where bloated overcharging has gone on the backs of the health service and its costs.
I think there are some examples of PFI deals that were particularly poorly constructed. I think there also are many thousands of contracts out there in the NHS with private organisations that deliver fantastic value. And when you look at the outcomes they deliver in terms of private hospital care, 19 of the best 20 hospitals for patient outcomes for hip and knee replacements, for example, are private hospitals patients care about. But we do also...
Best outcomes, what about the cost? Does it cost more or less?
It costs exactly the same. So a private hospital is paid exactly the same for a procedure on the NHS as an NHS provider is paid. There is no difference in price. I think that's something that's
So where does the profit come in?
It has to come in driving efficiencies and ensuring that service is done as well as possible. All healthcare providers are really well regulated these days. The Care Quality Commission does an excellent job at ensuring that standards are maintained, and therefore any organisation that cuts corners and delivers a poor quality service will quite quickly be exposed for that, and will reduce the amount of activity, quite rightly, that they get from the NHS.
Do you think that sometimes the relationship is too cosy? I mean, that you've got the NHS providers, if you like, spending other people's money and doing cosy deals, perhaps on the golf course with people selling them stuff.
No, I don't think so. I think there are clear guidelines and rules around how that behaviour needs to be managed. I think we've moved a long way in terms of that.
And what are the prospects now for the contribution of your network to the health service? Is it something that inevitably is going to increase, or what happens if a Labour government comes in and says we don't want it?
Well, I think, because of the fact that it's been a public-private partnership for 70 years, I don't think we're going to change that model. Nowhere else in the world has a wholly publicly provided service run entirely by the state. If you look at some of the European countries, in France, Italy, Austria, for example, a third of hospital beds are provided by the private sector. In Germany, it's near 50%. In Japan, actually, it's about 80%. So that model of private and public working collaboratively, I think, is absolutely embedded in the NHS. The extent to which that grows over the next few years, I think, has to depend on the quality of services that get provided. That is actually the most important question, not what percentage of the NHS budget goes to the private sector.
Did you feel threatened by the prospect of a Labour government?
Well, I think, look, let's see what happens. I think no government over 70 years has tried to apply a policy of 100% healthcare services. I think when politicians look at that and say, what does the public want? The public wants high quality care, free at the point of use. I don't think they would jeopardise that by ideologically driven change. I think it's actually about the service that's provided. Okay.